Dr. Arva, thank you very much for joining me.
Thank you for inviting.
We're going to dive deep into a subject where it shapes and makes life of two people and it gives them a new hope.
Yes.
You have chosen to take that role and responsibility. We are talking about IVF and reproduction. Out of all the topics and all the areas you could have gone in, medicine, everything else, why did you choose that?
When I entered medicine, I always wanted to be a pediatrician. I don't know if you read this book, Doctors by Eric Segal.
I will do now.
Okay, so in that the lead character, the female, is a pediatrician, and I was quite inspired, so I really wanted to be a pediatrician. But it so happened that my husband decided to take pediatrics, and he was a year senior to me, so I was like, you can't have two pediatricians in the same family.
It's a family, yes.
So then I decided, okay, let's look into OB-GYN. And then, luckily for me, in my fourth year of medical school, when you're actually studying the subject obstetrics and gynecology, I really got interested in fertility at that time itself, because IVF was relatively new. It was something fascinating, and at that time there were technologies that were being studied, like GIFT and ZIFT. You don't even, nowadays the students will not even hear about these technologies. GIFT stands for gamete intrafallopian transfer, and ZIFT stands for zygote intrafallopian transfer, where you actually would create an embryo and then put it inside the fallopian tube, laparoscopically, to get a baby or a woman pregnant. So those technologies were being researched, and it was so fascinating. So then I decided that this is my career path.
What time period are we talking?
Well, I finished my medical school in 1999. And then after that, I did my post-graduation in obstetrics and gynecology, which I completed in 2003.
Okay.
And then in 2004, I moved to UK to pursue my obstetrics and gynecology career further. And then towards the end of my career, then I focused mainly on reproductive medicine and infertility.
What is the deciding factor? What is it that motivated and drive you to go specialize in that subject? What did you have as a person? Because this is not about just qualification and practices and experience and knowledge. A lot of personalization, human being, how you feel inside.
I just found it very fascinating, that from that one sperm and then one egg, you're creating a human, and then when you deliver, when I was doing my internship as well, as part of when you finish medical school, when you do your internship, you do internship in your major subjects like medicine, surgery, and obstetric and gynecology for almost 2 months. And the labor room experience of, delivering women, and, the joy that brings to them, and the joy it brings to us also, as physicians, when you have that child in your hand, words can't explain it.
I'm a father, and I totally understand.
Yeah, so
where you're coming from.
You being a father, you can understand. You can't describe that
I'm
feeling.
still getting goosebumps now. I remember the time I had when my son was born. I still remember that time.
That is what motivated me to get into this specialty. I could have chosen an easy specialty, like dermatology or ophthalmology, where it is, it's more like laid back life, you can say, 9 to 5, you hardly get any emergencies. Obstetrics and gynecology, we run on adrenaline. Labor room is such an environment that, you have to be on your toes all the time. Anything can happen at any time, and we have to be prepared.
Talking about anything that can happen anytime, we're talking about IVF. People don't take that option because of everything success. It's because they've stumbled upon certain journey. Am I correct?
That's right.
Not everything is hanky-dory. Not everything goes away.
No.
How do you prepare for that? Because it's not about falling pregnant and coming to the hospital and giving. That's just a beautified world. But when you go into IVF, it's a personal space. In some families, some part of the world, I think it's still a taboo subject.
Yes, it is, because I will say more than taboo, it is the reluctance of couples to talk about it openly, because you might feel, you may think, or the couple may think that, you're going to be looked down upon because you can't get pregnant, or you're not able to, produce an offspring. So that's why couples don't talk freely about it. They don't share that journey, or they don't share their emotions with, like you would if you were giving birth. You've given birth, you will announce it to the world that, I have a child.
Yes.
But when you're struggling to get pregnant, you're not going to announce it to the world that I'm struggling to get pregnant, help me, or I'm going down this route. Because it's like you said, it's very personal, and you don't want people to judge you based on that, and people to look down upon you.
It's not that short journey. It's extended, and there are stages. How does one come to Dr. Alva? How do you make it very soothing for them, calm for them, that, hey, okay, I'm a doctor, but I'm a human being, I'm your friend. That's what they need at that moment, right?
Yes, they do need somebody to actually sit down and explain the process to them. In this day and age, there's so much information available, on social networks,
Yes.
on Google, Wikipedia. Anything you put in, the answers are there.
Is there?
But the problem with, going or following what you're reading on Google and on, social media is that you're always faced with the worst case scenarios. Nobody tells you the easier path also.
Okay.
It's always life-threatening situation. Just for example, headache. You look into the causes for headache. It will be stroke and this and that. It's like you're going to die the next minute. No, you're not. So for couples who are trying as well, and when they come to see us, some have not read anything, which is very good. It's like a fresh mind, fresh brain. You can tell them, okay, this is how it works. Some have read so much that they just get lost in that information, and to bring them out of that information and to just tell them, okay, this is just normal, give yourself more time, it will happen. It's very difficult.
That's all good. That's, again, you're giving information of a human perspective as opposed to the online perspective. But how do they relate to you? You have to build that bond. That bond is very, very special, and especially in your domain, I think.
It is, and that bond actually starts right from the first meeting. So when a couple comes to see me for their, for their consultation, I will always sit with them and take a detailed history, okay? Because when I take a detailed history looking into their family, and their social history and everything, I get an understanding of what their background is, what their journey is going to be, and also, what they expect. After that, to build that bond between the couple and myself, it is always going to be, being honest with them, straightforward, no beating around the bush. How it is, tell them. If there's a problem, I will tell them, see, this is the problem, this is the solution, and that will create trust. And once you have that trust, it is easy.
No two couples are same.
No two couples are
Different people have different way of perceiving and accepting things. Again, we did say that it is a very private moment. It's a very personal moment. Sometimes the husband doesn't want to talk to the wife about it. I know of these scenarios. The wife doesn't even open to the husband, but somebody coming and opening up to you. I know you said to me the best thing to do, Dil, is keep it black and white. Tell them as it is. These are the processes. But you must get attached to, you're human.
Yes.
You will build a better bond with somebody else. How do you differ that, and how does your practice allow you to continue that in your professional way and on a personal level?
I've been doing this for many years now. And like you said, we do get attached. Now, for me, I'm sort of I can say I'm in a unique situation, because most IVF doctors do not look after their women during pregnancies and don't deliver them. But I am still doing general obstetrics and gynecology. So I do find myself at times torn between, looking after them, getting them pregnant, and they really want to follow me, during the 9 months of pregnancy as well and do their delivery, which then I feel is a conflict of interest because I am very much vested in them. I do get emotionally attached to them.
Yes.
And when things don't go the way we want them, it is heartbreak for me as well. So I have made it a policy for me that, most often I will not carry on. Once I get the woman pregnant, then
I will not do the delivery.
I will not do the delivery. Because as it is, even if they've gone through IVF treatment, the couple is with you for not just 1 month or 2 months. You're going to be looking after them for, 5 months, 6 months, maybe longer as well. And emotional attachment always comes, and it's difficult if you then have to continue with the delivery and the pregnancy, and if any complications happens in the pregnancy, it's more emotionally challenging for me as well.
Talking about complications with IVF, it can be that first time round it doesn't work, so it's not your 9 months. How do you go and tell them that and tell them, hey, look, it's not end of it, let's go again? Because it is not that easy, because I believe there's a lot of stages involved that requires therefore to take medications and maybe surgeries even. So am I correct in that?
Yes. So if, say for example, if we, at the first consultation, if I pick up a problem that needs a surgical approach initially to maximize the chances, then, I will refer her on to a colleague who is, the right person to do that surgery. If I think I can do the surgery, I will do it for them. But if I think it's not in my capacity to do that surgery, then I will definitely, refer them to the appropriate physician for the surgery. And then once they come back, and I will tell them, maybe, just doing the surgery itself will improve your chances of getting pregnant. So don't be in a rush, have your surgery done, give yourself another 6 months, see what happens. If you don't get pregnant, then, we can think about starting the journey again.
Who's more easy to it, the wife or the husband?
That's tricky, but I think most often, see, men think differently, women think differently.
Absolutely.
Okay. Some men can be very intense. They really want to know each and every step and will make the decisions for the wife. Some women are very focused as well, and it's a balance always. In a relationship, I've always found that if the man is very intense, the wife is laid back. And if the wife is very intense, then the husband is laid back.
Look, I'm getting goosebumps. I'm getting butterflies because I'm just thinking, God forbid it doesn't happen. If he was my wife, I wouldn't be worried about what my surgery is. I would be worried more to as to what stages my wife has to go through. Because it is for them. For me, you can throw at me any part of the world, any scenarios. I've got to do it. But a woman's not that strong. So that's why I had to ask you that question, who's strong? Moving on to the next thing. One thing I told you that is not everyone's shaped mentally to address that, because it's not something nobody thinks about. Do you find yourself like, okay, now you really need to go on, I don't want you to go through that yet, you need to go and mentally prepare, or do you have to go through some, sessions of preparation prior to that, before any surgery or medical or anything, jump in the practice? Does it help?
Yes.
Is that option there?
Yes, that option is there, because sometimes when couples come, they've been trying for 1 year or 2 years. Usually, I always tell the couples that give yourself at least 1 year before you start having investigations, mainly for younger couples. If you're young, less than 35 years of age for the woman, that give yourself at least 1 year to see if you can get pregnant naturally. And if that doesn't happen after 1 year of trying, then seek medical advice. Not just, you've been trying for 3 months and you don't get pregnant, don't seek medical advice at that time. Some couples, after 1 year of trying, they come and, when we do the baseline investigations, you find out that, her ovarian reserve is low, or the man does, the semen analysis and we come to know that the sperm count is very low. It can come as a big shock to them because they're not prepared for it.
Absolutely no.
Okay, and then it takes, seeing them 2-3 times to make them understand that, but actually even if it is low, it's not the end of the world. Like you said, start telling them, okay, this is the process, this is what we are going to do. So yes, it does take 2-3 times, for them to understand it. Because in the first consultation, the minute you've told anyone some bad news, basically, isn't it? Once you've given the news, their mind that it closes. Whatever you have explained to them in that session, maybe 10% they will remember, 90% they will forget, or it's just gone over their head because they're still coming to terms with understanding that, this is something that is not good. So usually I will tell them, okay, this is it, go back, think about it, come back. Write down your questions and bring them along with you, because I'm sure you will have a lot of questions.
Yeah.
So you come back, see me, we will go through all your questions. I always tell my patients that, you always contact me by email as well. Email me anytime, I will answer. If I think I need to see you face to face as well, I'll call you back. It's very important. Face to face discussion sometimes is very important, so that you can explain everything to them. Sometimes, just talking does not help. You literally have to draw and show them figures as this is how it is, for them to have a better understanding as well of the procedure or, the steps as well.
Now I want to talk about the family aspect. Then I want to come back to you, because my head is blown up with queries and concerns and what people go through, especially amongst Asian families. It's not a subject that's very much known. Now, but I'm going back about 10 years, that wasn't so the case. And we said earlier that they feel as though they're not capable. The woman is made to be like, you're not capable. You are the root cause of it. Have you come across that?
Yes, many times.
It's a very difficult moment when they come to you with that. How is it that you've seen it to change over time? Has it changed over time, or is it still that time, okay, you're the culprit, because of you, my son can't have a baby and I can have a grandson or grandchild?
I think maybe it is changing, but very, very slowly. That concept is still there, that, it's the woman. Because so many times, I see in the clinic that only the woman has come. She's like, I'm struggling to get pregnant. And I said, I will tell her up front, next time you come, you have to bring your husband along with you, because it's not just you that wants a child. If it's only you that wants a child, then
you don't have the child.
Yeah.
You're in a problem.
It will create problems in your life later on as well, because your husband is not involved in this. So when you're trying for a pregnancy, you're always trying as a couple. It's not just the woman, or it's not just the man. It's always a couple. Even during the investigations, if the women's investigations are all normal, but you pick up a low sperm count and it's because of the male factor that the woman is not getting pregnant, it's still a couple problem. I will treat the male, but it's always together you want a child. It's not just her or it's not just him. It's us, isn't it?
100%. It takes two to tango,
and the mentality, it's not, I won't say it's just Asians. That mentality, I think, is more universal, where it's always the woman's fault. I have seen it. I have seen. Look, I have worked with a lot of different ethnicities, and from my experience, I will say, okay, you can say more Asian, but definitely.
No, this is just my personal experience. I'm just saying from mine. I'm not saying what the stats are.
It's more generalized.
Look, now I'm going to go to the next thing. I'm sure there's been a lot of success stories and everything and happy moments. But there is always that odd one. How do you get over that? Because you don't go in to find out, okay, it can be done. But obviously, it's your profession, it's a practice. You become habituated with that. You become used to that. But then again, you're a human being. You're a mother. Yeah. You're a female. More than anything, you understand it. How do you get around this and go on to tomorrow? Because it's not easy for you. Because you said to me, Dil, maybe I have to have 9 months with them. Maybe I have to have a journey with them. Maybe I have to tell them, okay, 1 year, carry on. How does Dr. Arva get to the next stage and look for another day?
Because I always look at the glass half full rather than half empty. And I always tell, there's always light at the end of the tunnel. Sometimes, to be honest, when you are really faced with difficult situations where you're seeing women having, repeated unsuccessful cycles, first cycle, yes, everyone can have that. Then the second cycle doesn't work. And then the third cycle doesn't work, And it really, brings me down as well. And it is difficult to get out of it.
I'm just getting into your story and I've got goosebumps. I'm getting shivers just to think about that. Just putting myself in the steps of a woman. Everyone wants to become a mother. They want to have kids. But just going that, even though I've looked at your subject just slightly, it's giving me shivers. So I wonder what you go through. Because you're the responsible person.
Yes, I am the responsible person. Even when it comes to giving them the news that it hasn't worked, I really take some time to prepare myself. I make sure that when I'm discussing something like this, I am not disturbed. I make sure I keep my phone on silent as well. I will not answer my phone so that my train of thoughts is not broken, and I'm giving my full compassion to that couple.
Have you found yourself to be literally broken and said, okay, I can't do nothing for 2 weeks, I'm going on a holiday?
No,
Have you done that?
No, I haven't done that.
No.
I think I have made myself mentally strong that way.
Okay.
Personally, when you go through something yourself, it does make you stronger.
Yes.
It does help you anticipate what problems, or what emotionally the woman or the couple is facing. Because yes, I have had a miscarriage. I know how it feels. So when I'm telling that woman, I know how you feel, you lost this baby, it's because I have been in that situation myself. So if you have gone through something, it does help you to empathize much better, because you know exactly what that couple is going through. So that helps me in, giving them the support. But also, some clinics, I don't know about in Dubai, how many clinics have it, but definitely when I was working back in UK, most of the clinics have a counselor, fertility
Yes.
counselor, who, offers the support to the couples, especially when, the cycle is unsuccessful or if they've had a miscarriage. And luckily in Orchid, we do have, a fertility nurse counselor who helps us quite a lot. So that support, additional support being there, is also very helpful.
Where are you practicing at the moment? In Dubai, where?
In Dubai at present, I'm working with Orchid Fertility.
Okay. So if they wanted to find you, because for me, it's about a personal experience.
It's always about the personal experience. People shop a lot over here in Dubai. Ultimately, they will eventually then come back to the doctor they felt most comfortable with.
Yeah,
The person who has been most open with them and given, taken time. Because sometimes patients do feel, couples do feel that they've been rushed through. And some couples have come to me telling them that they feel that it's all a business. It was so money minded when they've gone to see the doctor. It was all about do this.
You're just ticking the boxes.
Exactly.
I've been through it because I've lost a daughter at a very early stage. So I know exactly the journey, what my wife's gone through. That's why it's just causing me. I'm feeling the stages, what actually mother goes through. I've seen it firsthand. To this day, I still haven't got over it.
It's difficult.
I still don't know where my daughter's buried. I choose not to know. I want to know.
You don't want to know, you want to know.
I want to know, but I've been to UK 3-4 times, and it's something I've put to a side. I've just not come around to it. So I just wonder, only God knows what my wife went through it, how she gave birth, and how she saw that child isn't born. And she was lonely. And I personally even feel now, there was a nurse. I want to go and thank her for some of the things my wife's told me. So it is purely an individual between two people. I really think at that time it becomes a bond between you and the person giving the birth, not the husband. I wasn't in the picture. So I totally understand where you're coming from. We talked about a lot. We said that there's a lot of information on Google and online. I wish there was less Google doctors.
I agree.
I really wish there was no
agree.
Google doctors. I had I had a head injury, and I decided to come back, and I thought, okay, I'm going to heal myself faster. So I went to YouTube and started practicing this kind of stuff till the doctor told me that you can actually kill yourself doing what you're doing. I had a really bad head injury. Now, on that note, on a very serious note, what is it you think that people are misinformed about, ill-informed, and should know? What do we need to build more awareness around, and what would you like to see?
I would like to say that, people, or, I'll say people think IVF is magic. They always come to us thinking that, I have gone through IVF treatment, I should have a baby. But that's not true. IVF is not magic. We still have to work with, your body, your capacity. I cannot, sometimes, women will, like I said before as well, sometimes when you find that a woman has a low ovarian reserve, she is shocked. But she has gone through, the blog pages, or, she may have joined a group where, someone has discussed their fertility treatment. They collected 12 eggs, 13 eggs, 20 eggs. Why for me only 3? Because that is what your body
That's
is
your body
giving
is.
me. I cannot make your body give me 20 eggs when you don't have that reserve. So understand that, there are limitations to IVF treatment. It's not 100%. That is why we never give us 100% success rate, because it is not possible.
What is the success rate?
Success rate depends on the woman's age,
Individual.
unfortunately. Yeah. So, and even if you look at this, if you look at any of the guidelines, how the success rate in IVF is calculated, it's not an even spread. If you're doing statistics, you'll say, okay, 1 to 5, 5 to 10, 10 to 15, you go on like that.
You can't do that.
In IVF, you can't. So your success is less than 35 years, and then 35 to 37, 37 to 39, 40 to 41. So the age category is different, and as you get older, the success rate goes down, because you've got to remember that you are born with all the eggs that you're going to release. So when you are inside, when a baby girl is inside her mother's womb, she has 5 million eggs in the ovaries. By the time she's born, that number has already come down to 1 to 2 million. By the time she hits puberty, that number has already come down to 300 to 400,000. And in a woman's entire reproductive lifespan, you're going to release only around 300 to 400 eggs. So you can see the loss of eggs is so rapid. And you're not producing any new eggs. You're born with what you're going to release. So as you get older, your eggs are also getting older, and that is why the success rate as you get older decreases.
Can I just go back a little? Why do you think, I know it's maybe generic, it's not something medical. Why does someone go through that? What is it? Is there such pattern that because of they've done such things, or because of X, Y, Z?
Not necessarily. There are certain conditions which can, increase your the loss of the eggs from the ovaries. Like, for example, if you have cancer, you've gone through chemotherapy, you've gone through radiotherapy, especially if that's in the pelvic region, or chemotherapy, even for things like leukemia, lymphoma, because these are childhood cancers. Then for those girls, yes, the chance of having good quality eggs is going to be very low. There are certain genetic conditions, but that we will pick it up earlier as well, in which that something like Turner syndrome, okay, where you have one absent X chromosome. In those girls as well, the loss of eggs is very rapid, and the ovaries, become very small and almost like disappear as well. So those conditions we pick up, and those we know about. But then generally, why does a woman have a low ovarian reserve? Sometimes we don't find an answer. Whether it is genetic or not, I don't know for sure as yet. Whether environmental factors play a role, maybe, because our lifestyle has definitely changed.
It's changed a lot.
Even the age for puberty now, girls attain puberty at a much younger age. Previously age for puberty was around 13 to 14
12,
years.
13,
Now
yeah.
it is not. It's 10 to 11 years. So the, young girls who are still, mentally not mature enough to
Prepared.
understand physically what is going to happen to their body are going through those changes. So we are having to prepare our girls at a much younger age as well. And so you can see the change. So I think that change in, the age for puberty becoming earlier is a lot to do with our environmental factors, like the nutritional status and everything now.
So what would you like to see? Awareness around IVF, how would you like it to be spoken about and built around, and what information do you want to see?
With IVF, what I will say is first thing is, for the couples, don't rush into IVF if you're young. At least wait for 1 year before going into any fertility treatment. If you're older, then don't waste too much time, before seeking medical help, because your time is limited. All right, the clock is ticking, so your time is limited. Seek help earlier. And then, be prepared that it is not 100%. One more thing I would like to highlight over here is, a lot of girls who are more focused on their career, that, they think that, okay, when I'm 40, I will get pregnant, I'll go through IVF and I'll have a baby. But like I said before, at 40, it does make it difficult for us to get you pregnant as well. We try. Yes, I'm not saying that women don't get pregnant at 40 and 42 and 45 and 46 as well. You have to understand that the risk of miscarriage as you get older is also higher. So although you may get pregnant, the pregnancy may not be healthy. So that's something that you also have to be aware of. So if you are very career oriented, and you really know that definitely you want to have a family later on in life, but you want to start later on, then my suggestion will also be to consider freezing your eggs. Because if you do it at a younger age, your chances are better. The quality, your egg quality is going to be better because your eggs are young. So if you do it at 35, it is much better as compared to doing it at 40. Why? One, quality is better, number will also be more. At 40, the quality is not going to be very good, and also the number is going to be less. So if you're going to go through egg freezing at, say, 37 or 38, you might need at least 2 or 3 cycles of stimulation to get a good number of eggs for freezing. So this is something that also I want to create awareness about.
What is your approach to that now? What are you doing about it?
Well, whenever I see young girls who come to see me in the clinic, as my general OB-GYN practice, I do ask them, when do you want to start a family? And if they're already married, I always tell them, have one child before you're 35.
I would say have a child before you're 30. I was only talking about that in the office the other day, right? All the guys should get married by the age 26. And I was giving advice to somebody as well.
Well, 26 is too young, I think. But one child before 35, at least it guarantees that your, fertility. And even if, you have one child at 35, then you're struggling, your chances of success with IVF treatment is still going to be slightly better because you've given birth before.
What is your most, I don't know if I can go into that one, happiest moment, and what is your most touching moment?
Touching moment was, this is when I was working back in UK. This couple I had seen in the fertility clinic. They had come for their initial consultation, and as you know, on the NHS, you have to go on the waiting list for IVF treatment,
Yes,
isn't it? So she had her initial consultation with me, and then she was on the waiting list to start her IVF treatment, and then she fell pregnant naturally.
Oh.
And like I told you before, that I was in this unique position where I was doing IVF and I was doing general OB-GYN. It so happened that I was on call I was on call for labor room, and the same woman, she came in with very high fever and a lot of complications, and we had to end the pregnancy for her. She was only around 16, maybe 20 weeks pregnant. So she hadn't reached the stage of the baby being viable, if it was born early as well. But she was having a roaring infection which would have killed her had we not got the baby out for her, because the infection was inside the uterus.
How was your next day? Obviously, it's a profession for you and you see that a lot. But
I
still,
did go back to work the next day, because she's still under my care, so I have to see her and look after her till she gets better.
how is she mentally?
She then came back to see us
For the fertility treatment.
for the fertility treatment.
And I adore that. That's trust, that's comfort, that's reassurance. And that's when someone says, okay, you've done me something.
Yeah, so she did come back, and I did see her in the fertility clinic. Although to say, I don't know whether she got pregnant after that, because I left UK at that time and I moved to Dubai. But yeah, I did see her for the consultation back in the fertility clinic.
Where is Dr. Arva now? What would you like to see now?
Now, I will say that, I have a good work-life balance.
Nice.
I'm also a mother of 3 children. So it was very important to have a good work-life balance. So I do have that now. And I would like to do, more IVF practice as well. So encouraging, couples to seek treatment appropriately and also have the treatment at the right time. It's not just, it's not a business for me. It's, like individually, each couple, each one needs their own treatment, each one has their own needs. And one thing we didn't discuss is about cultural beliefs. There's a lot
Very
of
important.
there's a lot of cultural beliefs behind fertility treatment, and what the support they get from the family as well. So individualized treatment for everyone is very important, and I think I do offer that to my couples.
Look, I've spoken to you, and I feel very connected. That I can have a conversation with you. I've seen a lot. I'm old. I've seen a lot of doctors, and I feel as though they've seen me as a customer at a pharmacy. Not let's sign a prescription, get rid of him. I've had not like your role. I was just talking to my colleague. Somebody very close and dear to me is just got the last stage of the cancer, 4 stages. And I had a kind of a conversation with a family member. I said, what did they say? He said, Adil, I think it's just a practice they have. It's a job they have. And they said, oh, we'll tell her that she's end of her life. I was like, wow, doesn't matter what a profession is. When I'm in business, if I'm going to sit a client, that's not going to make money. I'll find it tough to tell them. I'll find a nice way to do it or give them a better solution. We talked about you. We talked about husband and wife and their family and their culture. Doctors that are coming in new in. What's your one piece of advice to them?
I didn't get the
Doctors, there are a lot of doctors that are going to go into the domain. So for some people, it's business. I'll tell you straight, frank, up and frank, blunt. For some doctors, sad to say, it's business. I have spoken to doctors in the same domain. Okay, maybe it was a wrong day. I called them, and I had this conversation. What would you say to them? And not even them. Because when I've read the books, it's like, okay, you've got to make your mind. They're going to die. You've got to tell them. There's all the patients. This is your career. This is your future. You need to tell them that. You need to be blunt about it. That's the textbook. What would you say to the educational institute and the doctors that are going to come in to serve people in the same domain as you?
One thing is, if you're going to get into this domain, you have to have a passion for it, first of all.
Absolutely.
Don't choose this profession or the specialty if you don't have a passion for it, or because somebody has forced you into it. You have to be passionate about your subject. Only if you're passionate about your subject, you will do well in your career as well. Otherwise, it's going to be a 9-to-5 job and it'll become like a business for you. If you're passionate about it, it's not about business. It's about, bringing that joy to that family, basically. See, for me, it's not a business. It's never been a business. It'll never be a business. It is for me to...
I can tell when I'm talking to you. You're very much personally attached.
It is about, when I deliver that baby, and I'm the first one holding that child, and when they come back to see me for follow-up, they tell their children, because it is children also sometimes, that she was the first one to hold you. You heard her voice first.
Nice. You must
so,
feel special.
Exactly.
These are memories, these are moments.
I may not remember now, how many babies I've delivered. I've lost count. I've been in this profession for more than 20 years.
Yeah.
So I have lost count. But, when my patients come and see me and bring their children along, and I was like, oh my goodness, how time has flown. That's the passion. That's what keeps me going as well. Even in IVF, because like I said before, IVF, maybe I may not deliver them, but when you see that heartbeat on ultrasound scan and, you see that flickering motion, it's like...
I've seen it.
It says, again, words can't describe that feeling.
Can't describe that moment. Look, I can only say thank you very much for bringing happiness, joy to people's life, helping them through this tough decision-making process of theirs. Whatever you are, who you meet, whoever your patient's going to be, I wish you all the best.
Thank you.
And,
thank you very much.
Pass on your experience to other doctors. I think you should become a voice to institutes, and where you go in, and when the students are coming in and preparing in their initiation stage, I think there should be more doctors like you involved, because we need people like you.
Thank you. Thank you very much. Thank you for having me.
My absolute pleasure. Thank you very much.